Be ready, 5 seconds. I thank the chair for giving me an opportunity to speak in this very important discussion on COVID-19. As our honorable speaker had mentioned that this debate should be used to showcase or allow us to give an example of what our respective states are doing in this situation of pandemic. I would like to take this opportunity to slightly elaborate on the work that has been done by the state of Meghalaya. Amidst the havoc caused by the COVID-19 pandemic, whereby global economies have crumbled and are now slowly on the path of recovery, the northeastern state of Meghalaya also bore the brunt of the crisis. Being a state with a large indigenous population coupled with a resource poor setting, the challenges have been unique for the state administration. This had called for a unique intervention. Under the leadership of our Chief Minister and our Health Minister, the entire state government machinery worked together in full force and was able to turn the pandemic crisis into an opportunity of sorts, especially in terms of building and strengthening our healthcare infrastructure. Since the start of the pandemic, Meghalaya adopted an evidence-based, data-driven approach of managing the pandemic, guided majorly by the problem-driven interactive adaptive model. During wave 1 of the pandemic, the state's community-centric behavioral change model, the BCM, garnered appreciation from the Union Health Ministry, which was later adopted nationwide as a COVID-19 appropriate behavior. A collaborative approach was adopted through the constitution of the State Response Team and the Medical Expert Committee comprising medical professionals and public healthcare experts from the state as well as across the country. In the second wave, Meghalaya was posed with a new set of challenges: COVID-19 testing and vaccine hesitancy. This led to an increase in the number of deaths caused by COVID-19 and a high case fatality ratio. Therefore, with an aim to save people's lives, the state administration, along with the team of private and public medical experts, formulated a breakthrough treatment protocol known as the Step-Up Treatment Protocol, based on the biphasic nature of COVID-19 virus. This was recognized by the ICMR and Lancet India Task Force for Managing COVID-19 for having been able to save numerous lives of persons affected by COVID-19 infection. Not only this, Meghalaya has been using the pandemic crisis as an opportunity to completely strengthen the public healthcare systems while investing in building infrastructure and capacity building. It may be noted that out of the total state budget, 8% is dedicated solely to the health sector. As per the Niti Aayog ranking, Meghalaya stands at the 8th position among all the states in terms of government budget spending on healthcare. Focus is now being laid on improving health indicators through increased spending. I am happy to inform that during the pandemic period itself, Meghalaya was able to come up with its own state health policy known as Mother Policy, which is an acronym for Measurable Outcomes in Transforming Health Sector through a holistic approach with focus on women's empowerment. I would like to take this opportunity to thank the Government of India for providing valuable assistance and support to our state through the Emergency Response and Health System Preparedness Package, Phase 1 and Phase 2, under which an amount of about Rs 90 crore has been sanctioned. This has been used by the state to not only strengthen but also build various infrastructures, especially in hard to reach areas. Through this, pediatric units have been strengthened in district hospitals, prefab structures have been built in PHCs and other subcenters, RT-PCR and RAT testing facilities and centers have also been built across all districts, including strengthening human resources to facilitate the entire process. There are IT systems in hospitals as well as teleconsultation services and ambulances. The state government also has invested in private hospitals to create more beds as a crisis emergency response and to be well prepared for any such further emergencies. I would also like to extend my gratitude to the Union Home Ministry and to the 15th Finance Commission for recently launching the Health Infrastructure Mission, which is also expected to provide financial assistance to the state. I am happy to inform that when the pandemic started, our state had about 4 ventilators, whereas today we have over 200 ventilators and 1100 oxygen supported beds in Meghalaya. I would like to flag 2 issues which have already been mentioned by some of the honorable members. Over 400 million people have been vaccinated. In my own state, I recently held a Disha meeting where the honorable DCs informed me that in the case of first dose, only about 50% vaccination has been done, and in the case of second dose, only about 30% vaccination has been done. That is a very low number.